With experiences from the massive effects of the Ebola outbreak that pillaged the West African nation Liberia, the country is galvanizing all efforts to institute measures for the global healthcare nightmare, the coronavirus outbreak known as COVID-19. As COVID-19 continues to spread in sub-Saharan Africa, the Liberian Airport Authority, in collaboration with the National Public Health Institute of Liberia, NPHIL, and the Ministry of Health, MOH, has instituted measures to ensure that people accessing Liberia main international airports are screened for symptoms related to the novel coronavirus.
We have mandatory washing of hands for both the inbound and outbound of our terminal, and that is not just limited to passengers. It's also include our workers, anyone flying the terminal, people around. By the time you come in, you have to make sure you wash your hands before getting in there. That is the first measure we put in place.
We have initiated enhanced screening at the airport. Initially, when we had international risks, we realized that the point of highest risk for an imported case would be the airport, so we launched since the 25th of January, enhanced screening of all travelers.
Coronaviruses, COV, are a large family of viruses that cause illness ranging from the common cold to more severe diseases such as Middle East Respiratory Syndrome, MERS-CoV, and severe acute respiratory syndrome, SARS-CoV. A novel coronavirus nCoV is a new strain that has been previously identified in humans. Public perception of the healthcare system and the doubting of local people that there was an Ebola outbreak in Liberia in 2014 resulted in a high number of people infected with the Ebola virus then. But it seems that this may not be the case with coronavirus.
No, now I'm confident. With this setup, there's absolutely no way Corona can pass here.
I think our preparedness is based on the fact that we've experienced Ebola, and of course, nobody needs to teach us, So I'm impressed with the Ministry of Health, NPHIL, and Liberian collaboratively willingness to ensure that this disease doesn't infiltrate in our territory.
I'm just impressed with what I'm seeing in Liberia now. I was worried when I heard of the coronavirus. Looking at what we suffered during Ebola, we were not very much prepared. So my worry has been how we prepare. So I'm actually surprised with what I'm seeing. I think it's something that impressed us, we the travelers, and those that are even thinking about coming and worrying about what they are going to meet and what they are going to see.
I've just come in and I'm very impressed with what I saw. The testing at the beginning and the washing of hands.
The growing positive public perception of the response is also showing that Liberia is ahead in ensuring adequate readiness for the viral disease that is currently plaguing the world.
I think Liberia has taken a good step in the right direction to have everyone wash their hands with soap upon entering the country. I think that's a good step.
Yeah, this is very good, very good. I mean, they are taking a lot of precautions.
Our resilience is higher, we are more prepared, and I want to use this opportunity to commend both the Airport Authority and our health authorities for the measures. The coronavirus is very serious and we have to take it seriously. So I'm pleased that I entered this airport, and unlike other airports I've just traveled, there is a rigorous training exercise. I think this is good and we should all submit to it.
The response mechanism instituted to ensure Liberia detects any case at its earliest stage possible goes beyond just temperature check and hand washing at the airport.
In the process of going through the temperature check, when we found out that you need to be referred, we have a container that we prepare. Both Dr. Fala and I, we prepare air-conditioned for reference, and we have the ambulances and others, health workers who are on the standby, who are also willing to receive those who will be checked, and right from there, they are taken to a place where later on they are released. And measure is put in place here, and I mean, we do it without any form of harassment, without any form of intimidation. The same way you come to the country when there was no coronavirus, it's the same way we carry out our normal routine. There is no need of being afraid. There's no fear.
The observation centers have already released several people that completed the quarantine period without any signs and symptoms of the illness.
And we took one step further. We introduced a form of quarantine that we call precautionary observation. Since the 2nd of February, all those coming from country with high and widespread transmission are taken from the airport to a place we call our precautionary observation center. We have had 150 persons go through that we've been monitoring. After 14 days, they are discharged.
The country has also beefed up its readiness by setting up a specialized laboratory to test coronavirus cases in the country. This contrasts with the serious problem faced in the early stages of the Ebola outbreak that Liberia had to send specimens out of the country to get tested, and it took days for the results to be available.
For our ability to test for corona is based on the fact that after Ebola, we now have the ability to test for Ebola that we do routinely in Lassa. So it is that same platform we just added when they send us a chemical in the region to test for corona. So we have had an infrastructure in place, people are aware based on the Ebola, and it's those opportunities that we are building upon to help us.
Are there mechanisms for proactive collaboration with the neighboring countries in the sub-region as was done during the Ebola outbreak?
Again, as a result of learning from Ebola, some 2 years ago we met in Freetown under the auspices of IOM USCDC to do cross-border collaboration. That was Liberia, Guinea, Sierra Leone, and the Ivory Coast. We created a platform. In fact, as I'm speaking to you now, there is a WhatsApp platform that we're having actively going on. We are going to have a conference call sometime tomorrow. So we call it POE, MROU POE. That's one thing we activated right now. But in direct connection, we also have managed to work with our Freetown colleague one-on-one day. My counterpart in Freetown, that family and I have a daily update. Anyone coming from the country of concern that arrive in Freetown gets quarantine. Anyone that comes from there here gets quarantine. And then we had 3 students who came from China, but they were Sierra Leone, and they came in Liberia. We quarantined them for 14 days. After the 14 days ended, our colleague in Freetown worked together. We turned them over to them at the border. So we have built a very cordial relationship with Freetown. Now we are going wider now with this MROU WhatsApp we just developed. One of the things we're advocating just this when we're talking is to have a quick conference call as quickly as possible. If we can't meet physically, we should meet virtually to move preparedness.
Funding for the preparedness of the response has been previously made by the government of Liberia. Until recently, the World Bank stepped in with additional support.
Well, this is the heartbeat of the president, that the citizens of this country be safe and be free from every epidemic. So anything it takes us to go beyond what we can do for our citizens to be safe and kept free, we'll go ahead and do it, because life is first and we want to preserve lives.
With absolutely no case of the coronavirus in Liberia, the NPHIL continues to issue travel advisories with precautionary measures to safeguard the country from the spread of the novel coronavirus.
To the traveling populace, once again, I'd like them to know that all is set. We are very, very prepared, and Liberia is a safe place to travel because we've put in measures into place.
Public information on COVID-19 is essential to drastically reduce the growing global infection rate. Key information provided by the World Health Organization (WHO) for public consumption include the following. Common signs of infection include respiratory symptoms, fever, cough, shortness of breath, and breathing difficulties. In most severe cases, the infection can cause pneumonia, severe acute respiratory syndrome, kidney failure, and even death. Standard recommendations to prevent infection spread include regular hand washing, covering mouth and nose when coughing and sneezing, thoroughly cooking meat and eggs. Avoid close contact with anyone showing symptoms of respiratory illness such as coughing and sneezing.